Greetings, family. Peace and love to you and yours. This is Guru, and thanks for visiting my channel. Family, this woman's skin melted off after she was given the wrong dosage of an antidepressant. This story is disturbing, but it's something that we should pay attention to, especially when we're going to these quacks. These doctors that we put so much trust into. Just because they're white, just because they have a robe that shows that they're a doctor or a nurse or what have you, you shouldn't just go with what they say cold blind-heartedly. You should definitely research the information that they tell you. Anyways, let's go to the story. So family, back in 2014, Kalia Shaw of Snellville, Georgia, began experiencing symptoms of depression. So she went to see a doctor who prescribed her an antidepressant called Lamotrigine, which she promptly filled at her local pharmacy. Lamotrigine is spelled Lamotrigine. Little did she know, however, that the prescription would change her life forever. For the first 2 weeks, Shaw took the medication and everything seemed to be just fine. But then suddenly, one day it wasn't. Blisters began appearing all over her body, and she was suddenly in excruciating pain. Quote, "It felt like I was on fire," Shaw told local news station 11 Alive. Shaw was quickly diagnosed with a rare but serious skin disorder called Stevens-Johnson syndrome, in which a person's skin dies, sheds, and heals itself again rapidly. She was kept in the hospital under a medically induced coma for 5 weeks after the diagnosis to allow her skin to go through the peeling process. When she awoke, she found her skin scarred, her vision poor, and her fingernails and sweat glands entirely gone. Quote, "I never lost anybody close to me, but that's what it feels like," unquote, she said. So, what caused these scarry symptoms? According to the Mayo Clinic, Stevens-Johnson syndrome is often triggered by a medication or infection, and Shaw believes an incorrect dosage of Lamotrigine is what spurred her case. But even though she stopped taking the responsible medication, the effects of the rare disorder aren't temporary. Even now, 3 years after her 5-week-long hospital stay, Shaw is still battling Stevens-Johnson syndrome. There's no cure, and there's a chance that the now 26-year-old could relapse. A lawsuit has been filed on Shaw's behalf, and 2 attorneys specializing in medication error litigation are representing her in the case. The attorneys claim that this case, and others like it, is the result of distracted pharmacists who, when they're rushed and poorly trained, incorrectly fill prescriptions or fail to notice errors. They say these mistakes can put patients at risk for serious health problems. Well, true indeed. And scary high medical bills. According to 11 Alive, the lawsuit reveals that Shaw's medical bills have already reached a total of nearly $3.5 million. Now, though, as Shaw awaits the results of the trial, she's speaking out about her experience and encouraging others to educate themselves about the potential dangers of their prescribed medications. I repeat, because this is worth repeating for my brothers and my sisters out there who totally put trust 100% in these white doctors and nurses. You guys do that because you put your guard down. You think that they know everything. I don't know what the issue is, but I have family members who have gone through this same type of situation. Not like her with this rare skin disorder, no, but the fact that we believe these white nurses and doctors simply because they're white and they say so. This young lady is saying, no, you need to educate yourselves about the potential dangers of prescribed medications. She says, quote, "I never heard of Stevens-Johnson's syndrome until I was in the hospital with my skin melting off my body," Shaw told 11 Alive. Quote, "It's important to know what's in your body. Be an advocate for yourself. Educate before you medicate." Again, educate before you medicate. Know what the side effects are. You know, the motherfucking side effects. That's right, family. I just wanted to bring this to you to show you what this beautiful sister has had to endure. Granted enough, it's a rare skin disorder, but as she warns each and every one of us, you should educate before you medicate, and it's very true. With that said, I'm going to leave this video off here. Thanks for watching. Peace and love to you and yours. And I pray for this beautiful sister because she is beautiful. Thanks for watching. Peace and love to you and yours. And until the next video, don't forget to subscribe. Peace out.